God aften. Kan I høre mig?
Ja, det kan vi godt.
Ja, nu kan jeg også selv... Undskyld, I kunne høre mig. Jeg havde slet slukket for lyden her. Hallo?
Det virker.
Det virker. Det var godt. Så skal jeg bare lige have mit barn slukke døren. Nå. Yes. Men god aften alle sammen, og velkommen her til det 3. webinar i anledning af Klovens år. Det er jo lige blevet rykket en lille smule, fordi at der var endnu et webinar i aften, som der er nogen, der skulle nå inden. Men jeg vil lige starte med at sige, at webinaret er støttet af Mælkeafgiftsfonden. And then, of course, a special welcome to Gerard, who is the speaker here this evening. Thank you very much for taking the time to hold this webinar. Do you want to share your screen?
There it is.
Super. Yes.
We're good to go.
Yes, I just unmute and.
Okay. Thank you for that introduction, and it's a pleasure to finally get the chance to talk to you. I was asked to talk a little bit about hoof trimming and risk factors, and like a true academic, I took that and changed it a little bit. So we're going to talk about hoof trimming, but typically when we talk about hoof trimming, especially when veterinarians talk about hoof trimming, we get talking about how hoof trimmers do it wrong, and I'd like to get talking about what the data says, what the science says about hoof trimming, and then move a little bit to how we should communicate and how we should take that knowledge and start talking to trimmers and have a conversation with them. Because I would argue we're misplacing our energies, trying to focus too much on trimming techniques, and we should focus more on actually working with each other instead of arguing about hoof trimming techniques and timing and everything else. So let's go forward and talk about that. So just so everybody knows, this is my conflict of interest. These are all the companies and people that have given me money to speak or support my research. So if I mention any products, it's basically not because they've given me money, it's because I think they are useful, but I don't think I mention any products in my talk, but just so you're aware of who supports my research and the activities that I do. We're going to talk a little bit today about trimming technique, some timing of trimming, and then some role and barriers for veterinarians as we talk through trimming and work on lameness. And I know you've had some talks already by Dr. John Huxley and Charlotte Kroger. So I'll touch a little bit on treatment stuff as I think it fits in, but most of that stuff we won't go into too much detail. I'm going to try to use some polling just to get some feedback, because I am in the US, so my circumstances are different than they would be in Denmark. So we're going to try to get you some feedback to see how different or how similar things are. I'm guessing they're very similar, but this is why I'm using some polling everywhere. So I can put this little link in the chat, or somebody can do that. I can do it right now, actually. And then you can go to that website, and once I activate the polls, you can participate and we can get some interaction happening through there. So let me just put that in the chat so people can enter. If you go to that website, or you can text, and that's a Danish number that you can text answers to. So we'll move forward with that. We'll do a little test question, and then we'll get into the presentation. We got that. So this is the test question. So who's going to win the soccer World Cup first? So I'm originally from Holland, so I have an allegiance still to the Dutch national team, although the Canadian national team, which I'm also from, is doing quite well recently. But I thought I'd ask a poll, say who's going to win the World Cup first? Is it going to be the Dutch or the Danish national team? Perfect. At least one person's got to figure out. At least one person voted. I'm not sure exactly how many people voted yet, but that's fine. At least we got it figured out. That's good. Okay, so the next question that's coming up is going to ask you about trimming technique, and it's going to be a question that you can vote on too. So if people say something that you were going to say, you can just vote on that one, and then it'll move up and down with it. I'm a little disappointed that there's nobody voted for the Dutch national team, but I'll accept it for today. So the question here is, what's the best hoof trimming technique? So here you can just type in an answer, and then if you see an answer that you like, you can just upvote it, or if you see something you don't like, you can actually downvote it too. So let's get some participation, get some thoughts, what people think. Interesting. I don't see that one very often to come up with first. So that's interesting because it looks like we're all trying to say the same thing here. So the white line atlas method. Interesting. Okay. And there's no competing theory, so everybody agrees. So that must be the one that's commonly practiced in Denmark, which I would argue is just a variation of the functional trimming method that's commonly, or people describe. I know there's small differences, but I would argue those are all small differences. We're going to talk a little bit more about trimming technique. Since you all seem to agree on this is the best method, we can get into a little bit more detail about trimming methods. So if I talk about trimming methods and I go looking into literature, actually there's only about 19 studies that talk about any sort of trimming method that do some comparison, either with trimming versus control, or compare trimming methods. And they might look at behavior, they might look at technique, or they might look at outcomes, and again, you have more soul ulcers or less soul ulcers. And there's some recent observational data too coming out, especially out of Denmark with your national database. So there's some studies that are coming out recently. However, they all very poorly describe the method they use, right? So it's very hard to say, this is how the foot was trimmed if I look at these studies and say, okay, what method do they ascribe to? They might say, well, I used the method described by Toussaint Raven, but if I've seen people trim, as they say, okay, trim according to the Dutch method, and I can ask people to do that, or ask people and look at them, and they all look different. So I'm going to show you some pictures of that too today. So even though there's only a few studies, I think there's huge variation between the actual technique that happens. And then if we go a little bit further, there's only about 8 studies that I'm aware of that I can read. In 8 studies, so the English language, maybe I have one Dutch state paper, maybe that describe how and when the trimming should happen. So that's a lot of that's not a lot of evidence to base our decisions on. But let's talk a little bit about it. So I recently worked on a study, or my grad student and I did, where we compared big or little models. So in different parts of the region, so in the US, there's quite an argument between hoof trimmers arguing if we should use a little or a big model, so to remove more weight underneath the flexor tuberosity, or a little model. I was a believer, I am a believer that the big model was beneficial, and I wanted to create some data to support that, right? So I am willing to change my mind. I am willing to look at evidence. I think as veterinarians, that's their obligation. So I wanted to create someone to test this evidence for it. So what do? We looked at 1,600 cows in 3 herds. These were in a recycled sand bedding herd. So these were herds that we thought were when we started the study in 2016 or 2015, were kind of what we thought we have a limited amount of funding to do this. We want to prove that this works, and what we think would be the most common at this point in time, at that point in time, and the most comfortable barn that exists. So if it works in this scenario, we figured it would work in other scenarios, because it's unlikely we're going to get money to repeat this in a mattress barn or in a slatted floor barn type scenario. So we picked one system to see if this technique would work, and we could argue if that's the right technique or not, but that's what we did. What we did with, we recruited 2 hoof trimmers. They enrolled cows weekly. So 1 week they would trim cows like this, use the big model, We used a little gauge. This worked out to be about 18 millimeters away from the axial wall. And then the next week, they would trim cows at dry off using this little gauge, and they would model about 42 millimeters away from the axial wall. And this roughly compares to what was traditionally described as the Dutch trimming method here, with a model where they say, okay, you have to have a pigeon egg that fits in between. And what Carl Berge would argue, this is the deep functional modeling that he kind of suggested and worked with. So that's kind of how the trimmers trimmed. And then we locomotion scored these cows every week, every other week. So we scored them before they were trimmed, and then we scored them after they freshened in the next lactation every other week. And then we looked at all these cows again at 100 and 150 days of milk at the hoof trimming to determine what lesions they have at this point in time. And these cows were all enrolled at dry off. So we enrolled cows in first lactation, second lactation, and third lactation when they were due just before their dry off date. So it happens roughly about 1 to 3 weeks before dry off. These cows were all trimmed using these two different methods. And if they had a lesion, so if they had an ulcer or a white line, we didn't enroll them. If they had digital dermatitis and some hemorrhaging, we did enroll them. And that information was noted when we enrolled them. So what are some of our results? So we had roughly about just under 1,200 cows at 100 and 150 days of milk. And then we had 1,100 cows that we had locomotion scores in the next lactation for. So that's kind of the cows we're basing our information from. Some cows obviously didn't make it the mid-lactation trim. Some cows' locomotion score was missed, or we didn't have a baseline locomotion score. But there was really no differences between groups for cows that were lost in either direction. So let's look at the lesions. So this is the lesions we were of main interest. So this is thin soles, sole ulcers, white line, and digital dermatitis. Those were kind of our main lesions of interest. And then we had 13% incidence of new lesions. So new lesions that happened. So they all started out as having no lesion. And then 13% had lesions and 11% for the big. So you can see there's maybe a little bit of an advantage, but not a huge advantage to the big model, just looking at overall lesions. And then if we look at the breakdown, we can see a little higher for the little with thin soles, and then this minor differences between the two. But overall, not a huge difference, not something that's earth-shattering and makes you go, wow, really have to use this method with it. So we could argue we need more cows to do this study. What was interesting, when we designed the study, we were looking for about 13% of lesions, 30% of lesions, and we ended up just under 15% with lesions, right? So that's a much lower sample size than we were expecting to have. So then if we look at this information in a statistical model, we found no evidence for a difference between the two different treatment groups. That's not saying they're the same. That's just saying in this study, we didn't find any evidence that they were much different, okay, in this particular scenario. However, if we look at just first lactation, so cows that were at their dry off period at first lactation, then we did notice a difference. So if you use the big model in that scenario, and then in the next lactation, you'd have, let's say you had 100 cows in first lactation, and you trimmed them with a big model, you'd have 5 less cows with lesions in the next lactation if you use the big model compared to the little model. So that was a difference that existed in first lactation animals, but not in second or third lactation animals. And then similarly for locomotion scores, there was a difference between the big model and the little model. So this graph tries to model time to lameness. So this is survival till they're lame. And then the yellow is the little model. And then the red line is the big model. And this is time to lameness. And basically this is based on the locomotion scoring data that we collected every 2 weeks. And if you're doing better than something, you'd be on the top of the graph, which means you're taking longer to become lame. So as you can see, there is a difference between these two cows, and it takes longer for the cows using the big model in first lactation to become lame. And that's, so this typically when we look at these graphs, we try to say, okay, what's the time to a 50% lameness or a median time to survival? And that in this scenario, the big model didn't reach it in our time frame. So there is a benefit in this scenario to using the big model in first lactation animals. Right, so just like most research had us asking more questions, but during the same time frame, some of the work out of the UK started to come out. saying that there's a huge difference between animals that have a history of lameness and cows that don't have a history of lameness. So I think one of the reasons is that these first lactation animals don't have the same amount of bony change as TP3. And I imagine Dr. John Huxley talked to you and showed you some of these pictures probably in different shapes or forms. But I think this is what's happening here. So these first lactation animals don't have the same history. So when we make an intervention, we can actually see a difference between these cows because there's not as much chronic changes that are happening. Whereas these older cows with more problems, so more bony protuberances and the flexor tuberosity or MP3, no matter what we do to these cows, our trimming technique probably doesn't impact them as much because there's already chronic changes happening into them. That's just the hypothesis at this stage, but it does illustrate that if we're going to do these trimming studies and compare trimming techniques, we should probably focus on cows that don't have a history of lesions, which makes a harder study and more time commitment and more data that's necessary to implement it. Okay, and then recently, this is a study from Malaysia where they also compared a big versus little model. They use a little different technique. I have questions about this trimming technique, but I wanted you to present to you some new data that's out there. So they used very similar type of scenarios. So they used 20 millimeters for the big model from the abaxial wall, and then they used 40 millimeters for what they call the Dutch trimming method for the little model. So very similar 2 millimeter differences, which I argue is not going to make a huge difference for the trimming techniques. And their control treatment was this treatment, and this was their, excuse me, their big model. They used probably what I would argue a bigger model on the non-weight bearing paw, so on the medial hoof. They modeled more than I typically would have in this scenario, but that's just an example. And this is an example of their trimming technique, which I also have some questions about because it looks like the axial wall here has been removed too. So that's just examples. And if we look at these categories, so this is the control group, which would mean they had no intervention. So here is the trim categories. And you can see there's some numerical differences, but statistically not much difference between it. Here, the big model is trim 2. So once again, maybe a little advantage here because there's less lesions here. But then later on, there's maybe a disadvantage. And then the further away you get from trimming or days in milk, it kind of ends up being a wash type thing. So what does this all mean, right? So this trimming technique, maybe there's something there, maybe there's not. Maybe we're barking up the wrong tree and we're looking at the wrong things. But let's look at timing, right? Because that's another argument we have. We should trim cows this way or that way. So here, what I'd like to talk about and get your input on is how many times does a cow need to be hoof trimmed per lactation? So your options are once, twice, 3 times, or when she needs it. And I'm not showing you the results as they happen because I don't want to bias your input to see what your peers are saying. We had 7 votes and people, oh, there we go. We're getting back up to 6. Okay, so let's see what the results show. Interesting. I like it. We have some disagreement. That's awesome. This is why I didn't show the pictures before, more people for it, right? So if I ask this question across the world, almost nobody ever picks once, typically twice or 3 times. And I'm surprised actually that how many people pick strategically when she needs it. And we're going to talk a little bit about more of these techniques, but I'm quite interested in these results and why you picked them. And there might be differences in what we mean here too, right? So typically twice or 3 times. I would argue people, if I'm in most scenarios in the US, that typically means that they're doing a whole herd trim if the herd is small enough. But as our herds get bigger, we've moved away to doing it. Every cow gets done twice, either at mid-lactation and they're going to dry off. So there's a little difference between twice and 3 times there. And then if 3 times, we might do another 160 or 90 to 120 days after the mid-lactation trim. But we can talk about that. So this is now locked. Okay. So the question, I have some data about this too. There's some data out from other places too. So there was a study done way back when I started my PhD work in Sweden that suggested that trimming cows at mid-lactation was or twice versus once a year was beneficial. But that was now over 20 years ago. Probably also not in an environment that's similar to, at least not similar to how cows are raised in the US, and probably also not similar to how cows are housed in Denmark, unless they have a lot of access to pasture type thing. So I think it's still an important question that we need to try and figure out. I like to make decisions based on data. So let's look at some of that data and some of the considerations. So in the same study that I showed you before, we enrolled cows. So when we trimmed them at dry off, we enrolled more cows in the control group because the control group cows were then trimmed again at mid-lactation or not trimmed at mid-lactation. So we looked at them, said, did you have a lesion? And then if they, whichever group they were in, then we trimmed them again with either a big model or a little model, or we didn't trim them. We ran them through the chute, picked up their foot and said, hey, do you have a lesion? Yes, no. And if they didn't, and there was no huge imbalance, because that was a deal we made with the farmer. If they were hugely overgrown or had a huge imbalance, then we would trim them. But if there was nothing that was really wrong with the foot, then we didn't trim them. So this is one study we did in one herd. And then, so this is just under 800 cows that we looked at in one herd. Basically, this is the breakdown with the different treatment groups that we're able to look at. And these are based on the same enrollment categories type thing. So this is, for example, these cows here that were trimmed with a big model, they would have been enrolled in the big model group as a control during that week in time. And then we had just under 600 cows that we had records for the next trimming. So this was typically would have been the dry off trim in this herd, but it could have been earlier if they were picked up lame. Basically, we said, okay, any trimming that happened after the mid-lactation trim, what lesion status did you have? We did not have funds to look at locomotion scores, so we basically relied on lesion data for this study. So let's look at the lesions. So if we look at the no trim group, 17% of these had lesions, no thin soles, 3% ulcers, 11% white line, which, considering this was recycled floor bedding or recycled sand bedding, and pretty abrasive floors, was not a surprise, maybe higher than we'd like to be, but the trimmer was very aggressive about recording these two. So any separation was also recorded as white line disease, and then 2% digital dermatitis. Then if we look at little, we can see a little bit of an increase in lesions. And then if we look at the big, there's even more of an increase. Statistically, there was no evidence of differences between these categories, but considering this was in one herd with limited sample size, this is enough that had me questioning whether if we had more sample size, this probably would have been a significant difference between the two categories, and an important difference anyway. So this leads me to question, do we need the mid-lactation trim in this specific herd, right? So one herd study, I can't generalize this to all other studies, but like other studies that have been done looking at mid-lactation trim, they kind of raise the same question. Some studies show maybe a potential benefit. So the study done in Florida that showed a potential benefit to it. The Swedish study did show a benefit to the mid-lactation trim. There's some other studies that have kind of conflicting data, kind of in a similar way, where we look at this and say, okay, well, maybe, maybe not, type thing. So this is, what do we do with this, right? So overall, no difference. But then what do we do, right? So if we're going to make decisions based on data, what other factors go into when we should trim a cow's foot, right? So the other thing we need to consider is, what's the impact of the cow when we trim these, on the cow's behavior and their milk production when we do trimming. So in the study that I was just telling you about, we had two categories. We had cows that received the trimming. So this is the top line, and cows that did not receive a trimming but went through the trimming chute, right? So they went through the trimming chute to look at. And then we could ask the question, what's the impact of taking a cow out of her regular routine, running her through the trim chute, and then putting her back in her pen, right? So in this dairy, cows are sorted every Thursday. They come in the morning milking, they come off the rotary parlor. This was a roughly 1,800 cow dairy. They were sorted, then the trimmer would trim them. And basically the cows are probably away from the pen, maybe, let's say, ranging from 1 to 3 hours a day. So the way look at this graph, we looked at their milk production. after trimming. So if here we have kind of the average milk production before hoof trimming. This is the day of hoof trimming. And then this is the time after hoof trimming, up to a week after trimming. And this is adjusting for the fact that days in milk and everything changes as this goes along. But you can see, so here these cows were, there's a decrease in milk production on the day of hoof trimming. Okay, that kind of makes sense. We're restricting their intake, their lying time, all those things are changed. But I would expect, before the study, I would have expected these cows to go right back up to the previous milk production and kind of stay there. But if we look at this graph and the two different treatment groups, they kind of look very similar, right? So part of that is the modeling technique we used. So the big group started off with higher milk production. So they started out around 57 kilograms of milk, and the other ones were just under 56. But they kind of follow the same pattern, right? So they go up, they decrease, and then they continue to kind of decrease after trimming. So even that's true for the cows that weren't trimmed. So we can't necessarily blame the trimmer or the trimming technique, because all we did is ran those cows through the chute, looked at them, picked their foot up, and let them back out. So this is an effect of taking cows away from their day-to-day activities, or that's one potential hypothesis that exists, right? So this is an impact of changing the lying time, changing their intake, and these cows need time to recover. When we look at this, this works out to about a kilogram of milk production that's changed, that's lost. So this is an impact that we have to consider when we on hoof trimming day. Even though we're trying to do something that helps the cow, there is a cost to it, with the cost being reduced milk production for a time period. The other thing we did, we tried to look at, okay, what's the impact of trimming on behavior? So the behavior we looked at was what's the impact on activity and lying time. When we did this using observational data, so we looked at farms in both the UK and Canada that were using the Affimilk Pedo Plus system. So they had both, they could measure lying time and activity at this point in time. And then we had 4 different herds that we did this on. Farm 1 was the bigger herd, the biggest herd, and you can see that these triangles is kind of showing the confidence interval around our estimates. And you can see some of these herds are smaller because they're smaller numbers, and there's wider estimates, or ranges of estimates around the confidence intervals. So what we're looking at here is kind of the same. So the day of hoof trimming is this dark gray. So if we look at, so the activity and resting time is a dashed line. So if we just follow a dashed line here, so this is the week before a baseline, then at the time of the day of hoof trimming, lying time goes down. But then actually what happens, it goes up, and it stays up for a week following trimming. Right, so this is baseline, and it goes up and stays up. However, in farm 2, nothing really changes. And then in farm 3 and 4, there's even bigger changes that happens within the categories. And all these farms had the trimming technique a little different. So this one, farm 1, was a larger farm, but the employees did most of the trimming with periodically the professional trimmer company would come in, but they would sort a large amount of cows out on trimming day, and then trim them and then bring them back to the pen. Farm 2, the herds manager, this was about a 600 cow dairy. The herds manager would trim 2 or 3 or maybe 4 or 5 cows a day, and that's it. So I would argue the lying time and the time away from the pen was a lot different here. And then farms 3 and 4 were more of the traditional, where the professional hoof trimmer comes in, does 40, 50 cows, and then it's gone. And farm 4 actually trimmed up to half the herd in one time period. And I think that's why we're seeing some of these bigger changes in this scenario. So if we take what we've learned before, so at the time of trimming, the cow's behavior changes, there's more lying time. And this is somewhat consistent across other studies too that have reported if we trim a cow's foot, her behavior changes, she acts more like a lame cow, where her lying time increases and her activity decreases, which is not necessarily a positive thing, but also her milk production is affected. So all this to say, when should we trim a cow's foot, right? So yes, we want to do it. So I would argue we want to trim a cow's foot when she needs it, because if she doesn't need it, there's a cost to it and probably a harm to it that we need to consider, right? And if we're going to do it, let's say 3 times lactation, those benefits need to outweigh the cost of the negative impacts on behavior and milk production when we do that. And we need data to support that too. Okay, so let's talk a little bit more about strategic trimming groups and how I would trim or think about trimming them. So to me, there's 4 different treatment groups on a dairy, or trimming groups on a dairy. The first group is the healthy cows, right? So these are the cows that have never had a lesion. They could be first lactation cows, third lactation cows that have never had a lesion, never been lame in their life, right? So how would we trim those cows? And I would argue we should trim those adjusting to wear, right? So in the scenario that I described, or this picture that I'm showing you here, in a herd with sand bedding with a lot of walking, do we really need to trim her more than once, right? What's the benefit of this? I don't know. I would argue the big model in first lactation animal maybe has a benefit, but we need to adjust it to wear. If this was a barn with a mattress, sawdust bedding on slatted floor, there's probably going to be more growth. So maybe then she needs to be trimmed twice the lactation to balance the wear and the growth. But if it's overwear or just long distances walking, we find even in herds using mattresses and non-sand bedding, so deep bedding or even rubber mattresses with a little bit of bedding on top. As herds get larger, there's more wear, and we have to question if we need to balance or to trim them. Then use data to say, okay, do we need to trim these cows? So what do I mean when I said use data, right? So we can use research data, but with the trimming data that's being collected by trimmers, I would argue as veterinarians or somebody needs to look at this data and say, what can we make recommendations for in your specific herd? So what does that look like? So this is actually the herd we did the study on, but this is an example of the data I used to make these decisions. So this is graphing days in milk here on the bottom, and then on the y-axis we have the count of events. And here we have the number of lesions, and I've just highlighted kind of digital dermatitis, sole ulcers, white line, and toe ulcer necrosis, and some other minor lesions, right? But you can see on this herd, they trim everybody at mid-lactation, and that's where most of the lesions get recorded. And then again, we have more lesions being recorded at the time of dry off. This to me indicates two things. One, we have a lot of lesions happening in mid-lactation, which probably means that the farm's not necessarily finding them. Because what I'd like to see is kind of no pattern in here, because that tells me that the farm either is finding all the lame cows when they occur and it's not the trimmer finding them, and there's no risk period that's happening, or there is a specific risk factor that's causing these lesions. But based on the knowledge I have of this farm, there's no specific. The risk factor is she goes through the trimming chute and the trimmer looks at her to find the lesion. That's the risk factor. There's no thing like standing time or lack of foot bathing that's causing this, right? So this is when we did the study, and the farm herds person asked me, and she said, "Can I stop mid-lactation trim?" And I said, "No, because the trimmer's finding all your lesions." But she said, "So if I get better at finding lame cows, maybe I can." And my argument was, yes, you could. So let's see what happens when we look at this herd a couple years down the road, right? So this is the same herd data, but now I've graphed it out a little more detailed. And we can look at it in a bit more detail. So this is the same graph, but looking at lactation groups after a year's worth of data, right? So same days in milk on the bottom. And here we can start seeing some patterns, right? So yes, count of events is, so for third lactation is still 56 at mid-lactation. But before, if we go back here, we're looking at close to 150 lesions here. And even if we add these up, we're not going to get to 150, right? So we've reduced the number of lesions that the trimmer is finding already. But let's look a little bit more detail, right? So if we look at this, let's remember this 56 number here, right? If we look at what lesions they actually are, in this scenario, the majority of those are actually digital dermatitis cases, right? So yes, these might be overdiagnosed or they might really be happening. But in this scenario, there's not a lot of digital dermatitis. I'm not expecting trimming to fix digital dermatitis. So, okay, that's useful information, helps me make a decision potentially. What about ulcers and white lines? So if I look at ulcers, we can look at the same pattern, right? So this dairy doesn't trim first lactation animals already in mid-lactation. And there's really no pattern of first lactation animals having ulcers. I would argue the same is true in second lactation. There's no real pattern for ulcers in second lactation, right? So even though we're trimming these ulcers right here, we're not finding very many in second lactation. However, in third lactation, we're finding more of them. What about white line disease? Kind of the same pattern as the ulcers, except because in this dairy, that's a major problem. We're finding more of these lesions and we're finding them early. So that's a good news. And there's actually here a bit of a pattern that after trimming, we're diagnosing some of them, which raises another question. But if we look at the totality of this data, there's two hypotheses we can have. We can say, okay, because we're trimming second lactation cows in mid-lactation, we're not having many lesions after for second lactation cows. Or the other alternative hypothesis is that because we know we're not trimming first lactation cows in mid-lactation, which doesn't seem to have an impact on them with more lesions in second lactation. So maybe the second lactation trim is not really helping us. We know it could be hurting us milk production wise and behavior wise, and maybe we should stop it. So on this dairy, what we've done is we've stopped mid-lactation trims for first and second lactations, but we're continuing to do it in third lactation cows or any cow that has a history of lesions, right? And we'll get to why that is there. But this is just an example of using records to make a decision to say, okay, we know from research that we should question whether the value of mid-lactation trim. And on this specific dairy, it kind of illustrates that one possible reason is that we don't have to do it in this dairy. And then depending on the risk tolerance of the farm, we can make that decision and say, okay, let's try it in second lactation and use data to monitor the impact of this. Okay, so strategic trimming for healthy cows. My recommendation is adjust the wear. So that's totally dependent. You need to look at the feet, talk to the trimmer, use the data. And then if we're going to do a dry off trim, or if we're going to do one trim, and I think they need at least one trim, I want them to have a dry off trim. And there's actually some good data out of Denmark, that's recently been shown to show that that's beneficial too, right? So there's some clinical trial data and then observational data because okay, if we're going to do a dry off trim, there's a benefit to doing those with less lesions later on. So even at minimum, I'm going to give this cow once a lactation trim. If she has in a high wear environment, in a low wear environment, I'm still going to do a dry off trim, and then I'm going to use the herd specific data to determine if she needs another trim. Okay, then the next group of cows. So these are the cows that are newly lame. So these are the cows that were in this group, and just by chance or bad luck, they have developed a lesion. So they've developed the severe hemorrhage or very early ulcer, and they need to be caught and identified, right? So we should find these cows early, actively look for them, and treat them appropriately. So these need to be treated immediately and appropriately. And I imagine Dr. Huxley's talked about how to appropriately treat them, what the benefits are of using NSAIDs. So we're not going to go into too much detail about these. But we would block them, remove the loose horn if there are hoof horn lesions. I would use NSAIDs. Unfortunately, in the US, we don't have licensed NSAIDs available to us, so it makes it more difficult. That's why on this slide it says consider. And then I would implement a recheck in 4 to 6 weeks at this point in time. But because you all are in Europe, I would definitely give these cows that have never had a history of lesions. As soon as they get a lesion, I would give them ketoprofen or some non-steroidal treatment to reduce the impact of chronicity on these cows. Okay. Then the next group of trimming cows, right? And we need to manage these groups differently. So we've managed these. Now we're going to manage the recheck cows. So cows that have a history of lesions that have recently been treated. So this is, to me, a group of cows where we need to say, okay, what happens to these cows? So they used to be in this group. Now we've treated them. How do we handle those cows? Right. So to me, these are the recheck cows. And it needs to be a program on a dairy to say, how are we going to treat these cows? So if the dairy practices a whole herd trim where the trimmer comes in, trims everybody all at once, and then leaves, what happens to the cow that needed a block? Is there a system to remove the block, to check the blocks, improve healing? I would argue that should be the expectation. It's like removing sutures after DA surgery, or if you've gone to the hospital because you've broken a finger, within 6 weeks, they want you to come back, look at the cast, do another x-ray. It's kind of the same treatment principle where you're saying, okay, we've treated this lesion. What are we going to do with it? Has it healed? Right. And to me, with current software and the trimming records that hoof trimmers have, if it's integrated with the farm's management software, we should be able to routinely create lists to say, okay, a month, I typically use a month after trimming, these are the cows that need to be rechecked. So they show up on the trim list. They say, okay, this cow here, for example, this is February. So she uses February trim date or recheck date. She was trimmed in early January and she had a white line lesion at this point in time. Right, so we can present that to the trimmer. We have this information, and then we can try to manage her to prevent chronicity in these animals. So what do we look for, right? So this is just an example here. So this is an example of a cow I treated. I'm getting old, almost 20 years ago, 10 years ago. But if I look at this ulcer, right? And this is just showing the progression of healing. But this is 5 days later. And by chance, I had her in my shoot for another reason. I was at the farm again. And I wanted to take a picture. So this is the amount of healing that happens after 5 days, or after 3 days, sorry, 3 weeks. But the benefit of this is we can remove the loose horn in this scenario again, right? So that's the benefit of rechecks. The things I look for is the lesion healing. And if it's not totally closed yet, I can remove loose horn again and kind of debride and improve the healing process, or the time and the speed of healing. I can also adjust the block, right? So if I look at the recheck and the block is no longer, it's doing its job and the cow is still painful, I can either apply a new block or I can adjust this block to improve healing process, right? And this is to me, the importance of these rechecks. We're trying to determine and assess healing, and we're trying to prevent problems, right? Because certain blocks we use don't fall off on their own, and then we can create problems underneath, right? So this is an example of a block that I applied, and then 4 weeks later, the cow was still walking somewhat lame. I removed the block, and there's a bit of hemorrhage here, and if I squeeze on this with the hoof testers, she was actually painful on the other hoof because of the block that I applied, right? And there's different techniques, blocking techniques that hopefully prevent these. But in this scenario, I was trying these blocks, seeing the impact of them and how the cows would walk on them, because these aren't the block I would typically apply or how I would typically apply them. But this is the purpose of the recheck, right? Because if we don't do the rechecks, I would argue if you put a block on a cow's foot, the cow is going to come back to your trimming chute at some point in time. And I'd rather control that time and say, I want her back in my chute in 4 to 6 weeks, instead of waiting 3 months for her to be lame because either the block's still on or the lesion hasn't healed appropriately, because then there's more damage to the cow's foot. Whereas if I can control the time, my hypothesis is we have less chronic bony changes inside P3 and more benefit. So these are the things I do. 4 to 6 weeks is when I look at them, and then I'm looking for healing and blocks. Then the next group, right? So these are the chronic cows. So these are the cows that have a history of lesions. So let's say they had a sole ulcer or white line. Maybe they've had multiple ones of these, and we can discuss whatever cut point this needs to be. But I'm going to manage these cows quite intensively, right? So compared to my healthy cows and cows that I know are healthy, I'd argue we've made enough progress in the dairy industry that we do a good job, and relatively few cows actually become lame. If we pull out the chronic history cows, there's actually a few cows that make the switch. And then there's even fewer cows that make it to this stage. But when we make it to the chronic stage, we need to manage those cows intensively and really try to manage them to reduce the impact of their pain that these bony changes persist. So what does that look like? To me, this is all due to this inflammatory process that I imagine Dr. Huxley kind of described. But the longer these cows are exposed to inflammation, the more bony changes we get in P3, and we can't reverse that. So in these cows, I get aggressive. I say, if you have a history of lesions, whether it be 1 or 2, I probably go to 1 if you had a history of ulcer and white line. I'm going to put you on my trim list every 3 to 4 months. So this is where my 3 times a year comes in, right? So these cows are going to get 3 times a year, because what I'm trying to do is prevent them from becoming an active ulcer again. I know I'm likely going to have some hemorrhage happening on these lesions, but I want to minimize the pressure underneath the flexor tuberosity. And I think trimming can accomplish that. And we can keep these cows walking. They're going to have abnormalities in gait, but they're not going to be severely lame. And if we manage them appropriately in that manner. So I'm going to trim these cows 3 times a month, 3 times a year. Ultimately, when we think about trimming, I have 2 criteria, right? So I go on the farms and I have these discussions. Actually happened yesterday with the trimmer. He says, I trim with this such and such method. And I've got to a stage, I used to be more hardcore, but I've gotten to this change that I have 2 criteria for how you trim cows. right? So the one is that healthy cows stay healthy, no matter what trimming method you use, whether it be the white line atlas method, or the balance method, or the functional trimming method, whatever you want to call it. I want the healthy cows to stay healthy, right? So if you trim the cow's foot and the trimmer trims the cow's foot and these cows go lame after, that's a problem. The other criteria I use, so that the cow tell me, is that lame cows need to get better as soon as possible, right? We can argue you got to use this block or that block. To me, the whole criteria is, what are we doing to make this cow heal as fast as possible? And I think that's where we can make a huge difference and have discussions with trimmers and have different techniques come into play, because I think that is probably a bigger area than arguing about this. Because yes, you can make cows lame with trimming, but most people don't do that anymore, right? We're talking about minor details and different trimming techniques. And to me, I've gotten to the stage where I say, as a hoof trimmer, I think my trimming method is the best. As a veterinarian, all I really care about is this. And as a scientist, I don't want to do these studies anymore because they're too hard to do and probably a low reward. I'd love to do more trimming studies, but they're really hard to do because we've gotten much better at cows and not enough cows. It's harder to find cows that develop lesions. So we need a huge sample size to show these differences. All right, so let's talk a little bit more about the role and barriers for veterinarians to get involved into this. So just another question to kind of get us started on this. The last time you communicated with a trimmer, so with a hoof trimmer, so this is for trimmers, about one of your clients was this week, this month, in the last 3 months, within the last year, or I've never talked to the trimmer because they don't talk to vets. Wow, this is good. I think there's a selection bias because the people that are listening to this webinar are probably talking to trimmers because they're interested in lameness, or there's a huge focus in Denmark for people to talk to trimmers. That's great. If I ask this question in the US, I get 1 or 2 people that say this a week, or in North America, I would argue North America. Even in the UK, I did this in the UK last month. I still get answers here. And within the last year, I didn't want to talk to vets. So I'm very happy. And maybe what I'm going to say next is not important because in Denmark, you guys are already all doing it. But let's talk a little bit about strategies and behavior change, or how we implement change on dairies. So if you think about trying to make a recommendation, right? So typically when we make a recommendation, it might be, let's change your trimming program. We want to go to twice a year type thing. Right. Typically, as veterinarians, we say, okay, this is what the farm should do. We're doing it because typically we think there's a benefit to doing it, right? So there's typically economic and non-economic benefits. You're going to have less cows with lesions. You're going to make more money. The cows are going to be better off. So those are all type benefits and advantages. And I would argue we as veterinarians focus on those aspects. However, in the human medicine, there's a huge body of literature that looks at behavior change models, things like theory of change or theory of planned behavior, and the health belief model that say we need to consider other characteristics that are happening in the background, right? So we focus on these things, but the farm, the person that's making that decision, has other things that are going on that help to either make them or not make them implement this change. Right, so there might be farmer characteristics, it might be the personality or the culture or the family. There might be problem awareness and responsibility. So if they don't think they have a lameness problem, why would they change? There might be effectiveness. So for example, foot bathing is a great example. If we want to say, okay, we think you should foot bathe this way, and the client typically says, well, I've tried that and it doesn't work, or my neighbor's tried it and it doesn't work. So if they don't believe in the change, they're not going to make the change. And then also their abilities, right? So if they don't think they can make the change because they don't have the labor or the knowledge, or it's not practical to make the change, they're also not going to do it. So all these things we need to consider when we make these changes. And if we can make our recommendations that address these characteristics, we're going to have better success with it. Right. So we recently did a study trying to say, okay, what happens when we talk to farmers, hoof trimmers, and veterinarians about lameness? This was done in kind of the US context or North American context because we talked to trimmers across the US. But in my experience, these findings are pretty transferable. I recently gave this talk in the UK, and some of these sentiments were pretty much exactly the same that were brought out. If you're really interested, you can take a look at this. This is done by my student, Dr. Aaron Winans, and some of my collaborators. It's open access, so you can take a look at it if you want more details about it. But basically what we did is we sat down, had a 30-minute to an hour conversation with these three groups, so with farmers, hoof trimmers, and veterinarians. And then we asked them specific questions. It was kind of a guided discussion where we had specific questions and then we listened to the responses. These groups were homogeneous, which means that if we're talking to a group of veterinarians, there's only veterinarians in this group. And then what we did is something called a qualitative analysis or a thematic analysis, where we looked at and said, okay, what were the most common themes that came up in these groups, right? So this is different than the trimming analysis where we did like quantitative, where we said, okay, this is the difference, this is the p-value. This is more saying, okay, what's the theme that happens? Because then we can kind of understand the discussion or the issue better, right? So one of the themes that came up is that lameness is a management challenge because it's complex, right? So people have different definitions. A lot of groups, especially farms, have normalized lameness. They're saying, okay, there's a normal level of lameness that happens in my herd and I can't do anything about it. But there's also huge farm to farm variation. So that's one major theme. And then the other themes we talked about, or we found in our study, was that there were different roles in lameness management, right? So what's the perception of their own role and what's the expectation of others? Because we talked to trimmers and veterinarians, what do they think of each other, right? So what's the farm expect of their advisors and what do they expect of each other, right? And some people think it's technical and some people think it's more consultative. So let's dig a little deeper into some of these things. One of the things we identified in some of the barriers that came up is that people were afraid to get out of their lane, right? So if you're a veterinarian, you're like, hey, this is my focus, that's it. So let's look at the context and think about some of these behavior change things that I talked about previously, right? So this is some quotes from our study that reflect kind of the sentiment of what people said. So this is one specific quote, but it's reflective of other issues or other quotes or things that people said. So this is a farmer talking about the importance of lameness. Yes, I believe it's the #1 issue in the farm because if you've got concrete, you've got lameness and there's no way around it. How do you manage it? No idea, right? So if we think about this health belief model, this farm and farms in general kind of feel lost, and because they feel they have no control of it. This could be because they're hearing different messages or they've tried different things that are happening. So that's a common sentiment we heard. And this is a response by a veterinarian. When you can't give a farmer a straight answer, when you can't just say, this is the answer, boom, they're like, I'm not wasting my time. So I did try to convince them that the latest research is the way to go at this moment, right? And the trimming discussion we just had might be a great example, right? So a client might ask you, how often should I trim my cows? And what they want to hear is do it 2 or 3 times a year, right? The answer we should be giving is, it depends, and let's talk about what it should look like, right? But that's a harder answer. I would argue it's a better answer, but it takes more conversation, more communication style, more conversation skills to have the discussion, right? So it's a harder conversation to have, and that's also frustrating and a barrier. And then there's perception of the farm by for veterinarians. I don't think most vets look forward to come out if you tell them it's right. Obviously that's not the case for people that are on this call, but I imagine it's the case for some of your colleagues, right? So if that's a perception of the farm that they don't think vets care, why would they talk to us about lameness, right? And then it's the same sentiment is true for hoof trimmers. I think hoof trimmers know more about the foot than a vet. That's not degrading vets because they have a lot more to look at than we do. I question if that's really true, but that's truly what the hoof trimmers think, right? And I've sat in some of these groups and this is what trimmers said, right? I know way more about a foot than the veterinarian does. Well, I would argue we've had more training in anatomy and all the physiology and all the other stuff that we probably know more about the foot if we applied it. We don't apply what we know about the foot, but we probably know more about the inside of the foot than trimmers do. There might be 1 or 2 trimmers that know more, but in general, I think we as vets probably know more. But are we using that knowledge? and then some more sentiments from the hoof trimmer. What I don't understand is these veterinarians coming out into these herds for herd health quite a bit. So herd health in the US means they come out to do pregnancy exams, kind of routine visits. And they see all these lame cows, and rarely do I see them telling the farmer, you should maybe trim a few more cows. Right, so this is the perception that exists. And then one of the veterinarian responding to, why don't you talk to a trimmer, or let's have more communication with it. So this is their response. I think it's probably in the same room as the hoof trimmer asking us about repro protocols. You probably get defensive about the same thing because that's what we're very good at. So it's just about how comfortable you are with what you know. Are you willing to work with them? Are you going to be reserved and stay in your lane mentality, right? So we realize we have a skill set, and are we going to use that? Or are we afraid and just going to defer and leave it to hoof trimmers? So I think I've outlined that some of these things are happening, and then the question becomes, what can we do about it? How can we address some of these things? Right, so I think the answer to this is teamwork, right? And I was very excited to see that a lot of you are talking routinely to trimmers. That's within the last month. At least everybody's talked to them. Some of you have talked to the trimmer this week, right? And this is great. This is to me where it starts, right? Because I would argue sometimes that's gets us out of the comfort zone, but it actually gets more success for our clients, right? And this is ultimately what the goal should be, right? And it's going to take communication. What does that look like? It could be just a WhatsApp message, right? Or it could be regular phone call or email, just providing updates that the trimmer sends to you and you send to the trimmer saying, this is what I'm noticing, what are you seeing? So when we asked our participants in this study, if they have a lot of teamwork with each other, or if they work together, this is a perspective of a farmer. We work with a veterinarian, we work with a trimmer, but not together, right? Which is common. But then they also see the value in it, right? Well, I think with the more communication you have with the hoof trimmer, the more you get a pulse of what's actually going on in the dairy, right? So this is a veterinarian that sees the benefits. They might struggle with making it happen, but they usually see the benefit. And same with the hoof trimmer, right? If we can all talk with each other, we can deliver a consistent and concise, and most importantly, concise message to the farmer, right? So two things there, trying to say, okay, we want a concise, probably an easy answer, but we also want it to be consistent, which I would argue with lameness is very hard to do because a lot of people, a lot of stakeholders, nutritionists, veterinarians, hoof trimmers, all have a different view of things, but we're not very good about delivering this consistent message. Whereas if we do, I think it would help the client, the farm, because now they're getting a consistent message. They're not getting different perspectives. They might feel that they have control because everybody's telling them the same thing, like, oh, I can do that because I've heard a nutritionist talk about it. I've had a veterinarian talk about it, right? It's a consistent message. So they're not hopeless, right? So what obstacles, and maybe this is an irrelevant question because it looks like most of you are already doing it, but what obstacles when you're doing it right now exist for you to develop a more team-based approach to working on lameness and trimming type things? I'm laughing because that's typically the response I get. Okay, so time, yes, and then interest, knowledge. Okay, that's a good one. We're on this call, so that's a good thing. Okay, those are some good answers, right? So lack of knowledge, the time, imagine maybe the smaller means refer to smaller herds, time together. So that would be typically the trimmer and the veterinarian. How do you get them together? I think those things are all important. So what can we do, right? So how can we address some of those things? Because those are real concerns. So to kind of talk about it, to kind of look at what we could do or something simple that maybe we could do. What we try to do is we try to force them, artificially force them. So what we did is we had a vet clinic, with 4 vets, 5 hoof trimmers, and then 4 nutritionists. we put them together. So we gave them incentive. We gave them some money to say, come together, come spend half a day with us. We're going to put you in the same room. We're going to talk to each other. So we're going to force you to learn about each other. And then we're going to give you some homework, trying to answer the question, can we facilitate people working together, right? Can we address some of this lack of time, knowledge, those type of things, right? So we gave them some knowledge in this meeting, but trying to adjust some of these things that you all raised. Can we encourage you to do some of this stuff? And specifically, we were trying to address these two areas. So we're trying to address problem awareness and perceived responsibility, focusing on the perceived responsibility and the ability to make change. Because when talking to some of these people, sometimes individually they don't feel they can make a change, but maybe as a team we can, right? So these are the two areas we kind of focused our things on. So what we did is we put these people together in a room, and then we worked through two cases. So we kind of had a half-day session. We gave them two cases. So we said, okay, a case with a herd with this problem. Work together as all vets, all hoof trimmers, all veterinarian, or all nutritionists. How would you approach this problem? And then we gave them a second problem where we mixed the team people up and say, okay, now you're working as a team. How would you address this other problem? And then we kind of had a sharing session saying, okay, what did you learn? What did you think? How would you address it, right? But the whole intent is trying to get these people to make relationships with each other, right? And then we gave them some resources, right? So some of you identified lack of knowledge. So we gave them some knowledge, right? We created a risk assessment. This is by no means a special risk assessments. There's different risk assessments that are out there. But we gave them one, right? Saying, okay, use this tool to improve your knowledge about lameness, but to also assess the herd and start conversations. And then we gave them some resources. So we gave them, okay, this is how to set up some fact sheets, right? So this is how to set up your farm management system, some fact sheets about foot bathing, some fact sheets about different treatments, for example, right? So we gave them these resources, and then we gave them some homework. So we encouraged them to go after the meeting. So after this half-day meeting, because we wanted to be respectful of their time, we gave them some homework and said, we want you to go and have 2 meetings with a farm where you, as either a nutritionist or veterinarian, leads it, but there has to be another member present, right? So if you're a veterinarian, a hoof trimmer, or a nutritionist needs to be present at these meetings at particular farms, because this farm shared some clients, these farms. So these people all shared different clients. So we encouraged them to have a meeting together and evaluate and implement some of these things, right? So do the risk assessment, then set up a team meeting. And we didn't say the veterinarian has to lead it or the hoof trimmer has to lead it. We said, okay, go forth and do this, because in one farm, the veterinarian might be have the best relationship. On the other farm, it might be the trimmer. So we left some open flexibility there with it. And then we gave them a small financial incentive to do this, to repay them for their time, trying to say, okay, what's required to make this happen? So we gave them, I think we gave them $500 US dollars. So we paid them roughly for 2 to 3 hours of their time for participating, which isn't, they invested more time in doing this project, but we wanted to reward some of their involvement, right? And then we asked them for feedback, right? So how did you feel about doing these type of things? So this is some examples for it. So this is an example from a hoof trimmer. I think it was a good review. Both farms, so this hoof trimmer did too, thought it was awesome. And one farmer said, I didn't really know what to expect. The owner goes, but that was really, really productive. So the trimmer here says, I felt the same way because I didn't really think that. I didn't know what to expect either. And it felt was pretty productive, especially with this specific action plan. So we had the farms we had the person do the risk assessment, but the team meeting, the goal was at the end, they had to all agree on an action plan. Okay, what are we going to do? Type thing. Right. This is another veterinarian. I was impressed with the level of interest. So this is talking about interest of the other groups, right? Particularly by the hoof trimmers primarily, and not just interest in the topic of lameness, but interest in communicating and being in the loop. Right. And this is the same veterinarian, but different, talking about challenges. There's a mistake we made. There was management things that as a group, we, the advisors, so the hoof trimmer veterinarians, were concerned about, but it probably wasn't a good time to bring it up to the farmer in that meeting, right? So although we encouraged that the meetings, the farms maybe thought lameness wasn't important, right? So they didn't think it was a priority for them, whereas the veterinarian and the trimmer did, right? So we have to be cognizant of those type of things as advisors when we're working together. So if we take it back and kind of say, okay, take it back to trimming to kind of wrap things up, I think there's a huge opportunity for us as an industry, I think worldwide, to take the knowledge we have about trimming techniques, trimming styles, data, and communication, and get out of our comfort zone to really focus and ensuring that lame cows get better and healthy cows stay healthy. Because I do think we have the knowledge. It's just a matter of dedicating our time and resources to do this. And with that, I'd be happy to take questions. I do want to put this on your radar. We're organizing a lameness conference in Minnesota next year in August. So if you're really into lameness and really want to get more knowledge, this is a great conference to come and attend. I'm part of the organizing committee. I'm the unofficial chair. So if you have questions about it, I'd love to talk about it, or I'd love to see you then, and we can have more discussion. But I know we have lots of time for questions. I purposely left lots of time for questions, so be happy to take them.
I have a question. If you think that we kind of reached the goal with trimming technique, or reached a goal, I don't know, but it's not important, as important you say. We still though have quite a lot of lesions and quite a lot of lameness. So how come we have we have reached the goal?
So great question. I'm reluctant to say we've reached the goal. What I'm trying to say, and I think maybe didn't clarify as well, is that I think we're overemphasizing the importance of trimming technique on the goal, right? If the goal is to reduce the number of lame cows, I don't think trimming technique is going to magically drop it in half, right? We make incremental gains with small changes in trimming technique, maybe. But the goal to reduce lameness, I would argue the biggest thing we can do is start looking for lame cows and detecting them and treating them as fast as possible to reduce the chronicity. That's the biggest thing we can do to reduce the number of lame cows we have in any herd. You're going to find more lame cows. You're going to have a higher incidence of lameness, but you're going to have a much lower prevalence of lameness. Because I believe the reason we see so many lame cows is because we let the chronic cows accumulate and they stay in our system. Because cows are amazing. They can handle a certain amount of pain and they're still productive. And that's where I think we focus on trimming technique too much and we argue about it too much, whereas we don't argue about how do we find lame cows faster. So I agree with you, we still have too many lesions, but I would argue half of those lesions are there because the cow was chronic. At least half of them are there because the cow was chronic. She had that lesion before. There was a history of lameness. And we need to address why she got that and how much, why she got chronic. Because when we do these studies, I can get like 1 to 2% sole ulcer incidence with cows with no history of lesion. How much lower can we go? I'm not sure. Like there's probably, maybe we can get half that percent, but trimming technique at that level doesn't make a difference. But that's because I removed all the chronic cows from that population. So I think that's what we need to focus our energy on. So I guess I'm arguing that the focus should be on the right things, not on about arguing about trimming technique, because I think that's the wrong focus.
Then I have a follow-up question to that. Do you think it's, in your opinion, is it then the environment and the stables and feeding and everything, is that the main risk factor, or is it the genetics? Or
Great question. So a couple of things. So I think genetics have a role to play. However, it's a very long-term process, right? So I think we can make changes in the environment that address lameness quite immediately, whereas the genetic aspect takes a much longer time period. So I don't want to discount genetics. I'm involved in a project looking at genetics, but I don't think it's going to be the be all and end all, and it shouldn't be the focus solely. Then what do I think the problem is? In most cases, if I break categories, so digital dermatitis, to me, it's how we run our foot bath, right? We can worry about hygiene, but there's only so much we can do with hygiene, right? So to me, the risk factor, if you have a farm with too much digital dermatitis, is because they're not foot bathing appropriately, either not enough, wrong product, wrong frequency, those type of things, right? So that comes down to management and environment. And then if I'm thinking about farms with sole ulcers and white lines, for white lines, I kind of focus on the flooring. So how are they managing moving cows to the parlor, or how are they managing when cows walks on, for example, slather floors, those type of things. And for sole ulcers, I look at kind of the transition period and standing time. Having said all that, I've been trying to create a project where I try to induce cows to have sole ulcers, and it's incredibly hard. So I've manipulated lining time to very low levels. I've made these cows, given an inflammatory event, reduce their energy balance, and I still can't induce sole ulcers. So experimentally, at least, it's really hard to create sole ulcers. So I don't think we know exactly what it is, but we do know enough to say if you have comfortable stalls, have lying times around 11 to 12 hours, cows will recover when they get lame. You'll reduce the number of lesions you get. If you feed them consistently, I'm not a big believer that nutrition has a huge role to play in sole ulcer development, but I think it's the consistently, right? Because we don't want these cows standing around waiting for feed or being out of feed and then splurging on feed, having a large intake of feed, right? So that's where I think nutrition has a role to play, but I think that's more management than feeding too much of XYZ ingredient type thing. So I think the biggest opportunity is trying to address management and how those things happen. And then genetics does have a role to play, but that's a much longer progress. Other questions?
Well, Gerard, I have a question. It's Nuna. Hi, how
Yep.
are you doing?
Good, how are you? I recognize the voice.
Yeah. It's very nice talk. Very nice to hear some interesting points. I was wondering in the study you did with Stoddard, where you found that you only saw a change in first lactation cows. Did you record all the mild lesions? Because you focused here, now you presented the toe ulcers and sole ulcers and white line disease, but was an indication that the mild lesions would increase, decrease?
Great question. So the short answer is no. So I think you're referring, did we record hemorrhages, right? I'm guessing what you're referring to.
Yeah, and white line separations.
Yes, right. So the white line category includes white line separations. That's why it was probably higher than I expected to be for just white line disease. With sole hemorrhages, we recorded so we told the trimmers to record sole hemorrhage if it was painful. So if they used the hoof testers and they saw a sole hemorrhage, but we didn't have them record minor variation of sole hemorrhages. For several reasons, and I would have, if I was to do that study again, I would record it. But 5 years ago, I didn't, because I've done a follow-up study in a different herd where we recorded hemorrhages, and that was like 60–70% of cows had some form of hemorrhages. Yeah. The struggle I have with recording hemorrhages is how do I get it recorded consistently and across different trimmers, right? And then those type of things. But if I was to do this again, I would find a way to record hemorrhages, because I think you're right, that might have a role to play. And
But
good
I
answers
think
from
that
good residents.
that the mild lesions are very important indicators of when it goes wrong, because cows with soul hemorrhages, we might be able to prevent the soul ulcers and the debilitating, you know, all the exostosis and changes in the bone. We also see a lot of osteolysis, so lack of pedal bone from both from the white line disease and but also from the soul ulcers. And
Yes.
and I mean, they are lost causes. We can help them and treat them and trim them and treat them and trim them. But the most interesting part is how do we make sure not new cows go down that road?
Yes. And if you have a good way to get trimmers to consistently record hemorrhage, I'd love to hear it. I think it's going to have to resort to taking pictures of the foot as they're trimming, because I think that's the only, I've tried to do it, and it just, when I enter them in my model, the biggest variable becomes the trimmer, not what's happening in the cow.
Exactly, but that's the same problem that I have. I have to pay them per soul hemorrhage that they record, then I get them.
Yes, that's, so when I found 60 to 70%, we had students I was paying doing the trimming and the looking at it, right? So anytime you see it, just write it down. But then it becomes how much is important, right? Because we've trimmed feet and you have a little bit of a speck of hemorrhage and it disappears with one swipe of the knife. Is that important? I don't know.
No.
Right. And we have no good way. And then the question I always have is, if I have that speck of hemorrhage, what I'd love to do is take a group and compare ones that have it and the ones we treat. But as soon as you look and find it, you're intervening into the cow. So then it's harder. We need a better way to find hemorrhages. But
yeah, and still you don't know how much hemorrhage they have worn off already.
Exactly.
So, yeah.
No more questions? We have more time, so.
Moon and I can keep talking lameness research.
Yeah, you just do that.
I have a question, since I was very surprised at how often or how frequently people communicated with the trimmers. Is that a routine practice in Denmark, or is that because the group of people here are interested and they do it?
I think you have a very special group of people here, as far as I can see from the names.
Okay, that's what I thought. So selection bias is real.
Yes, I definitely think that that this is a good group of people, and I also think that we actually have quite a lot of communications between trimmers and veterinarians, not just the people here and the trimmers here, but also, you know, in general. It's improving a lot, I think.
So what did you do to make that improve?
I don't know, actually. I think that we have some veterinarians beginning to get the interest, and then we have the recording. So we have trimmers recording, and then they actually have something to start out talking about. Yeah, and I think that the farmer really wants, the motivated farmers, they want both the vet and the trimmer to get into this and find a solution or come up with some good ideas.
Yes.
Gerard, this is Andreas. I'm a vet student from here from Denmark, and I'm a master's student of Nynnes. Could you maybe give some ideas to veterinarians on how to do the interpretation of these claw registrations? Because we spoke with some different claw trimmers, and I think almost all of them explained that they had all met veterinarians who suddenly looked at claw registrations and saw a lot of sick cows, and then started doing a lot of advice, or giving a lot of advice to the farmer on different things that he thinks that he should change, because suddenly all his cows became sick, which made the farmer ask the trimmer to not do the claw recordings, which I think we should have turn this spiral around. So instead, veterinarians learn how to do the interpretation and then help the farmers.
Great question. So yes, and I think so. I think the concern you express is real. I think, and that's where it becomes tactful, right? So I think as veterinarians, we have a training to identify and solve problems. So I think that's the first thing we see. We say like, oh, you have, I don't know, let's use the 70% hemorrhages, right? As let's say the trimmer is very good about recording hemorrhages, you're going to get a high number. You're going to get 20, 30% of hemorrhages on your cows. And yes, it's very easy to not record that, and then you don't have that problem anymore. So I think as veterinarians, you say, okay, the advice I would give is we have to really make sure we ask the right questions, right? Because if a lot of reports, at least with the programs here, I don't know how the programs work in Denmark, but typically the trimmer leaves a report that says this many cows that I trimmed today had lesions, right? So it might be 50, 60% or 80% of the cows had no lesions. And then I have this many cows with ulcers, this many cows with white lines. So the advice I give veterinarians is you need to have an appropriate denominator for those reports, right? And to me, there's two things that I look at. I look at across the whole herd. So if I have a 100 cow herd and I trim them strategically, I never look at, or I very rarely just look at the report that the trimmer leaves on the trimming day. I want to look at it over a time period. And then I also want to look at it considering the history of the cow. So I like to be able to split my reports up saying, okay, which cows have a history of lesions? Because they're going to have more lesions automatically. And there's very little we can do to change that. So the biggest report I look at is, okay, for the cows that were healthy and have no history, how many cows of those are getting lesions? And I think that number is going to be much lower. And then I think we can, because those cows we can intervene at and make decisions about. The other cows, I don't think we know what to do with them other than manage them and trim them and those type of things. But I think we need to tell, as veterinarians, focus on cows that have recently become lame, right? So cows that didn't have a history of lesions, that's the ones we can make decisions about. And then the number is going to be much lower unless you're looking at hemorrhages. And then hemorrhages, we have to, I think, you have to talk to the trimmer and say, okay, what are we recording as hemorrhages? Because some trimmers record everything and some trimmers record very little. So to me, when I see a big number, the first thing I think we as veterinarians need to do is ask more questions before we start giving advice. And I would argue your advice should also probably come in the form of a question instead of just come out and saying, do this type of thing. Because that's how we're trained to say, you need to give this antibiotic to fix this problem. And it's probably when lameness, because it's so complex, to say, okay, let's sit down or let's have this conversation to figure out what's really going on, because it's not as simple as saying, do this and your problem's fixed. Because I can take you to herds where I have lying time that is 10 hours and they have very low number of sow ulcers. And I take the other herds that have much higher level of sow ulcers and they're doing what we think is better. So it's way more complicated than we think it is.
I have one more question. You talk about that lameness should be most important, that you need to focus on identifying lame cows. And I also know that's very difficult. Not the really lame cows, we can all see those, but yeah, the moderately lame cows, and especially farmers have difficult to find them. Do you train farmers in identifying lame cows, or?
Yes and no. I've tried. The farms, So to me, the biggest hurdle becomes the time commitment to do it, right? As farms get larger, you're basically paying somebody to stand around and watch cows, which is a hard hurdle. So the way we've gotten to some farms to do it is to split that time up, right? So instead of looking at all the cows on one day, they look at a pen, let's say 1 week or 1 day a week, and then the next pen, depending on this, how many pens there are, right? So if the pen, let's say the farm has 8 pens or 7 pens, every day they look at 1 pen, right? So it's a shorter time period. And then it's truly looking at like for the moderately lame cows. And then it's saying, okay, don't look for the 3-legged lame cows. You can pick those cows out. Look for changes in stride length is the one I find easiest to look for. I think in the future, automation is going to get there. I'm not sure we're there yet, but I think we're all working on trying to get there. But I think that's a long-term future. And I think with that, we have to get past the saying, okay, how does it agree with lesions? We have to ask the question, does it make a difference when we intervene? Because we can answer blue in the face, does it make a difference with, does it correlate with locomotion score? Does it correlate with lesions? That doesn't matter, I would argue. What matters is when we make an intervention based on that alarm, does it make a difference to the cow, which is a much harder study to do. I don't know if that answers your question, but it is.
It did answer my question. And I think that is now, Mariana, you can maybe also about this, looking at lame cows out in the herd. You often do it like a sample of cows, right? 10%, 15% when you do the herd visits.
Yeah, when we do welfare visits, we do a sample. It's often not a very big sample, but we think the most important is to walk with the farmer, to talk to him about which cows he sees. I think that's the good part, because the sample will always be too small. So that's more for education.
Yes, I think that's a great point, right? So when you walk with a farm and say, what do you think about that cow? And they might say, oh, I think she's fine. And then you look at her. And if you have a chute available, it's even more illuminating, right? You say, okay, let's bring in the chute because I think she's lame. And you pick up the foot and you might see, for example, a minor hemorrhage and like, well, that's nothing. I'm like, well, we just talked about how it changes your gait, right? So then it becomes really powerful.
Yeah. So, but it's very important to find the right person, the owner. Sometimes you just walk with some of the employees and they see the problem, but the owner don't see it. That's sometimes a problem.
Yes.
Yeah. So, yes, but I think that we had spent the evening well, and now we have used 1.5 hours. So I think it's, if there one last question maybe, or we would just say thank you very much to Gerard. It was a very nice talk and very good discussion. Yes. So
thank you. It was a pleasure.
Yes, thank you, you too. So yes, that was all.
Thank you.
Good night, everybody.
Bye.
Bye.